healthcare, and preventable diseases continue to claim lives. The need for sustainable health financing. Health systems must be able to provide access to quality health services without imposing financial hardships on individuals or households. This means that sustainable financing goes beyond merely increasing funds for health. It is mobilized, allocated, and utilized efficiently for both short, medium, and long-term impact. We've heard today that the Abuja Declaration has been reiterated here, and about increasing budgetary allocation to health services to 15% annually. More than 20 years after this declaration, many countries still struggle to fulfill the commitment. Africa continues to rely solely on donor funding and foreign aids, with which, although helpful, are often unpredictable and unsustainable. Instead, we must develop innovative financing strategies tailored to our unique challenges and circumstances. What is the role of First Ladies in driving change? As First Ladies, we recognize our influential position and have been leveraging our position and platform to advocate for increased government funding for health, encourage private sector investment, and engage international partners in supporting country-specific interventions. For instance, some of the First Ladies' initiatives to increase sustainable financing for health in Africa include Organization of African First Ladies for Development, OAFLAD. Founded in the year 2002, OAFLAD advocates collectively for effective policies and strategies aimed at eliminating HIV/AIDS, reducing child and maternal mortality and morbidity, and empowering women and children. Through OAFLAD, we collaborate with international organizations, governments, to mobilize resources and implement health programs. One of such programs is the Free to Shine campaign. This campaign by each First Ladies focuses on ending childhood HIV and promoting maternal health. Through this initiative, we advocate for 3 key areas: keeping women and girls HIV-free, preventing vertical transmission of the virus from mother to child, and ensuring that children and adolescents living with HIV receives necessary services. 23 countries, including Nigeria, have successfully launched the Free to Shine campaign, and this has increased awareness and directed funding towards these critical health issues. Also, on national health initiatives, as the global and national Stop Tuberculosis champion, I mobilize funding through the Renewed Hope initiative, which I chair, for the control of tuberculosis in Nigeria, and continue to advocate for increased financial resources for tuberculosis and other health priorities nationally. Other First Ladies are doing similar advocacy for increased funding for health programs in their respective countries. In addition, OAFLAD is involved in advocacy of cervical cancer screening and introduced the human papilloma virus HPV vaccine for prevention. In Nigeria, we introduced the vaccine to be included in our routine national immunization schedule. As First Ladies, we will continue to use our platform to promote domestic resource mobilization through initiatives such as expanding health insurance coverage, fostering public-private partnerships in healthcare, and adopting policies to increase domestic resources for health. Call to action. Given the increasing funding gap for health on the continent, I urge us all to come together and commit to advocating for increased national health budgets. In line with the Abuja Declaration, our governments should allocate at least 15% of their budgetary allocations to health. We must also support innovative financing mechanisms and explore sustainable models such as expanding health insurance coverage, health endowment funds, and investments from African diaspora. Accountability and transparency must be ensured, as funds allocated to health must be used efficiently and effectively. We must continue to work closely with all levels of government, the private sector, civil society, and development partners to increase financing for health and strengthen our health systems. A healthy Africa is a prosperous Africa. The future of our continent depends on the well-being of our people. Let us act with urgency, commitment, and dedication. Together, let us build a robust healthcare system that will stand the test of time and serve future generations, one that truly leaves no one behind. Thank you. May God bless the continent of Africa.